going to talk about how to avoid a brow ptosis today. And typically with brow ptosis, what you want to be aware of is the frontalis muscle. And if the frontalis muscle is over-injected with too much Botox, or the placement of the Botox is wrong, then what can happen is the brow can actually get heavy. You can either take a woman's arched eyebrow away, give her a horizontal brow, which most women do not like, or you can actually lower the brow and cause her to look like this, so it almost looks like she's got a little shelf sitting on top of her brow, which pushes her eyelid down and creates more lid laxity here, which most women don't like. So with this particular patient here, we have a small forehead that we're dealing with, but the horizontal lines on her eyebrows bother her. So I'm going to ask you to raise your eyebrows for me as hard as you can. So when she animates here, you can see the lines that go from one side of the forehead to the other. And I'll have you relax now. Because this is a small forehead, again, and we're not treating the glabellar complex, we have to move down into the middle to lower 1/3 of the forehead, which we know it as the danger zone. If you come down in here, when you're injecting the glabellar complex, you'll cause a brow ptosis. So in order to avoid this, when simply treating the forehead alone, we're going to stay 1 finger width above the lowest fold produced when she animates. So for purposes of education, I'm going to mark that out right now. So if you'll raise your eyebrows for me. So here is that lowest fold produced. So all of our injections, we're going to stay above the red line here. There, that's more uniform. Okay, so I'm going to mark her real quick and then I'll step back so that we can take a look. Okay, raise your eyebrows again for me. Okay, relax now. And one more time up. And relax. And one more time up. And relax. The other thing that this particular patient has is she has deep set eyes. So these are not hooded eyes. At her age, this is just a deep set eye, meaning her eyes sit back farther in the eye socket itself. So she doesn't show a lot of lid to begin with. So this is a particular patient that we want to be very careful on. So what I would probably do here, since this is a narrow forehead, I've chosen to not do 4 injection sites, but 3. So the 2 lateral injections are in line with the pupil. The middle injection is in line with the root of the nose. So I would make these, and remember we can choose between 1 or 2 units here. I would make these 2s, so 2, 2, 2, and then animate again for me, okay, and relax. I would also make these 2s, 2 and 2, and then 1 and 1. So that would be a total of 2, 4, 6, 8, 10, 11, 12 units of Botox. I'm going to have this patient come back in 10 to 14 days so I can reassess. I may need to add a little bit more, but this is a conservative way to treat this patient. And raise up one more time for me here. Yeah. Because she has comma lines that extend all the way over, we're going to have to do this comma line injection. You want to make sure you only get 1 unit of Botox here so that we don't drop the brow. Okay, and that's how to avoid a brow ptosis. Hi Anna, you're here today for some Botox in your forehead, and we're going to talk about how to avoid a forehead ptosis, or an eyebrow ptosis, I mean. So basically, when she raises her eyebrows here, raise up for me as hard as you can. There you go, okay. Basically, she's concerned with the lines on her forehead. So when treating just the forehead alone and not the glabellar complex, we basically want to stay above the lowest fold produced when she animates. So raise your eyebrows one more time for me, good. So we want to stay above this line right here with all of our injections. By staying above that line, you are ensuring that you're not going to create a brow ptosis. The second thing we want to be careful of is not to place too many units of Botox into the forehead. This is the only muscle that raises the brow, so if we relax that muscle too much, then she can no longer raise her brow, and in addition to that, she may even get a slight drooping of the brow or ptosis. So, if I was going to treat this patient here, I'm going to mark right in line with the pupil and the upper 1/3 of the forehead, in line with the medial canthus. And then my next row, I'm going to actually stagger in between my top row. And then staying above this lowest fold produced when she animates, I'd probably put one more one more injection of Botox here. So I'm going to make these 2s, 2, 4, 6, 8, 10, 12, 14, and one more here for 15. Again, above the lowest fold produced when she animates, and being careful to not place too much Botox into the frontalis muscle. And that's how to avoid a brow ptosis. This is Mike, and he's here today for Botox treatment of the forehead. And Mike has deep set eyes. The eyebrows sit low on the forehead. So with him, we want to be careful that number one, we don't put too much Botox into his forehead, because we definitely don't want to give him a heavy brow. And number two, we don't want to create a ptosis. So again, we're going to stay above the lowest fold produced when he animates. That will help with that. And we're going to watch our units as well. So can you raise your eyebrows for me, Mike? Okay, and relax now. Okay, so I drew a line right in the lowest fold that's produced. So all of our injections are going to stay above the red line. And I'm going to go on and mark him now. So in line with the pupil, in line with the medial canthus. We're going to stagger our second row. Raise up one more time for me and relax now. And Mike makes pretty good comma lines as well, so we're going to go on and do 2 injections into the comma lines. You're going to turn up for me and relax. So I'm going to make all of these 2s, 2, 2, 2, 2, with the exception of the comma lines. These are going to be 1s since we're lateral to the pupil. Okay, Mike, here we go. A little stick. These are 1s. And we have 2 left. I'm going to go on and place this into that procerus muscle. All right, so that was a total of 20 units of Botox. And that's how we avoid a brow ptosis.